Hi, I'm Frank Diamond, the managing editor of Infection Control Today, and I'm zooming in here with my guest, Linda Spaulding, who visited with us just last week to talk about how infection preventionists should deal with the flu on top of COVID-19. So why is Linda back so soon? Because she is a perfectionist. That's one of the reasons why we're proud to have her on our editorial advisory board. Linda is such a perfectionist that she told me that she wasn't satisfied with her presentation last week. She feels that she left out some important information. So she's back, and we're always glad to have Linda Spaulding with us for whatever reason. She's a pro's pro. Okay, Linda, what is it that you think that you may have left out last week that infection preventionists and the rest of us need to know?
Well, I think there's a couple things. You know how COVID is changing almost by the hour. And one of the most important things that I feel I didn't stress enough in the last interview was mask. I think we're getting so used to wearing masks all the time. As healthcare workers, we don't even think the word mask because we always have it on. And with the upcoming flu season coming and COVID not going away anytime soon, there's a couple things that could happen during flu season. One, we may find that less people come down with the flu because more people are wearing masks. So masks don't only prevent COVID, but it also prevents the flu. And on the other hand, we might also find out that we do have more COVID cases detected because if people come down with flu symptoms, which are similar to COVID symptoms, then we may find out that they're co-infected or that they don't have flu, they have COVID. In the past week, I have been doing so many workups on COVID cases that it's amazing the astronomical numbers of asymptomatic individuals that we're finding with COVID. Now, a lot of the CDC and the news media report, it could be 40, 50% of the people that have COVID are asymptomatic. And I'm seeing that a whole lot right now because we're finding spouses of healthcare workers coming down with COVID, only to find out that when we check the healthcare worker is positive, but they're asymptomatic. We're finding the same thing with kids. The kids may get admitted or see the ER physician because of symptoms, and we find out that there's a parent that's asymptomatic, or the parent gets sick, we decide to test the whole family, and they have children in the house, and the children are asymptomatic, but the parents are getting COVID. So my hope at this point is we will see less flu because a mask will protect people from the flu. And we will identify more asymptomatic carriers so we can move them away from other people in order to prevent others from becoming symptomatic. So I think that's the key right here.
So what's your advice for infection preventionists in the hospitals? Now, let me back up a little bit. You're right now in Florida, is that correct?
Yes.
And you're seeing a big surge there?
Oh, definitely are.
And you're seeing a big surge in asymptomatic carriers.
Yes.
And asymptomatic healthcare worker carriers who's either given it to their spouses or got it from their spouses or somebody else in their family?
Right.
So what's the bottom line as far as what infection preventionists should do? Just basically just keep on pushing that everybody should wear a mask in the hospital?
Yes, definitely. I heard a study this morning, I can't remember if it was out of Denmark or someplace else, but I'm gonna find the study and I'll try to share the information with Infection Control Today. But it talked about, they did a laser review of a lot of different types of masks that are out on the market. And one of the things they found, which makes mask testing so simple for people at home, is if you take a flashlight and shine it on the inside of the mask, if you can see the light on the outside of the mask, then that mask probably isn't good enough to protect you from COVID. Now, just that study alone tells us so much that we didn't know yesterday. So for infection preventionists in the hospital, it's important to just get extremely good at contact tracing. If you have an employee that tests positive, find out who they've been around. If an employee calls you and tells you their family member is positive, then keep that in mind as your employees are coming to work. But know that there are a lot of asymptomatic carriers around us, be it children or a lot of young adults. And so those are the people we have to be monitoring when we're having them come in to visit in the hospital, or if they're admitted to the hospital and they have illnesses that we just don't understand. And most importantly, for IPs, know that if people have diarrhea, that is a huge sign that they may have COVID. We're seeing a lot of people with only diarrhea, no fever, no respiratory tract infection, and we're starting to see those people come back positive for COVID. And most people look for respiratory tract infections and fever. So keep in mind, GI is very important also to track, especially during flu season, because if people get influenza B, usually you see GI upset. But this year, think about COVID also.
It's interesting you mentioned the study about masks. I saw a study from Duke University where they looked at 14 different types of masks and how well they protect somebody from COVID or protect somebody else from getting COVID from you. And of course, N95s were the top of the list. And they found out that neck gaiters, which a lot of athletes might use when they're running and jogging outside, are actually, they're worse than having no mask at all. So the question.
That's the article that I was referring to right there. I just couldn't remember off the top of my head.
Okay, great. But so what the question is asking is, how closely should infection preventionists monitor the wearing of masks, even up to the point where they're saying to somebody who's wearing a neck gaiter, hey, that's not good here. You have to go here's another mask, use this, or you have to leave and get better protection?
Yeah, in the healthcare setting, we don't let anyone, well, I'm speaking for the healthcare settings I've been in. We don't let anybody wear anything other than the mask we provide, because we know that those masks will protect them. Now, what they do once they leave work is anybody's guess. So that's our biggest concern. We have listening sessions with staff, and we talk to them about proper mask wearing 24/7. And we can do a listening session and we still have people sitting there with a mask under their nose while we're telling them not to. So you have to continuously stress this among healthcare workers, be it whatever department. All departments have to be wearing the mask correctly, and everybody in the facility must be monitoring those people, not just the IPs.
It's shocking that you're telling me that healthcare workers are this is healthcare workers that you're talking about, not seeming to listen to the good guidelines. It's shocking to me. Is it shocking to you?
No, not really, because we have very different cultures, very different belief systems. And some people still believe COVID is a farce. It doesn't really exist. It's made up. And then other people
even healthcare workers believe that, you think?
Yes, you have some in healthcare that believe that. And you have to remember, not all healthcare workers are being impacted by COVID. It's mainly the ICUs and the COVID units that are set up in hospitals. Other regular medical surgical units and oncology units that aren't dealing with COVID patients, they have to take the same precautions, but they're not seeing the results of COVID because there's a whole lot of other situations out there other than COVID that some people are dealing with.
And you mentioned that infection preventionists, of course, have to keep a close eye out in the hospitals where they work. but people do what they want to do when they're outside of work. Do IPs have any bearing on that? Do they try to educate so that the people, healthcare workers, when they leave work, take the lessons with them?
We try to instill that in them. But it's almost like with some individuals, once they walk out the door, they forget what they just did the last 8 or 10 hours. And so the more we just keep reinforcing, but sometimes what it takes is those people that don't want to follow the masking out in public and that kind of thing. If one of their family members gets sick, sometimes that's a wake-up call. If one of them gets sick, there's been a few people that have been interviewed in the news media that, oh, I always thought this wasn't any big deal until I got it.
Right.
So people have to sometimes experience things firsthand, because if they never see it, never experience it, it's like, well, it really doesn't exist. It has nothing to do with me.
Okay, so let me paraphrase what I think you just told me, is that you're stressing the use of masks, the proper use of masks, and the proper use of masks might help prevent the spread of flu as sort of a byproduct.
Right.
So any final words for your fellow infection preventionists about the flu and COVID riding in together into their area and how to deal with that?
Just keep doing the regular surveillance that we do on a daily basis. Follow up things closely. If you're going to test for flu, you're probably going to have to test for COVID if we have the ability to test for COVID. There's still areas in the US that don't have the ability to test as much as they need to. So just keep doing what you're doing and keep track of the CDC website, because we don't know what's going to happen if somebody's co-infected with the flu and COVID. It's never happened before. So are we going to be sitting here talking about something that nobody expected to happen when these two mix?
Wow.
So we're just going to have to monitor it closely and keep the staff informed and track everybody.
Okay, words of wisdom from Linda Spaulding, the pro's pro, who wanted to come back and tie up some loose ends that she felt she had in her presentation last week. Linda, thank you as always for visiting.
Thank you for giving me the chance to clear up the mask issue.
Okay.